मसाले तो बहुत हैं, पर प्रकृति की गोद से खास चुने मसाले जिनकी ताजगी, खुशबू और स्वाद रहे बरकरार, ऐसे उम्दा मसाले बनाते हैं सिर्फ कैच। कैच का कोई मैच नहीं, 100%।
The global pandemic has impacted the lives of many and posed an unprecedented challenge to our health and mental well-being. But is there a way to move forward? Will the pandemic ever end? In the upcoming session, we have Jonathan D. Quick, author of the book The End of Epidemics: How to Stop Viruses and Save Humanity Now, who delves into the many ways we can end the endemic and also prevent one in the future. In conversation will be Rama Nagarajan, an assistant editor at the Times of India.
I'm Dr. Jonathan Quick. I'm currently a professor of global health at the Duke Global Health Institute and author of the book, The End of Epidemics: How to Stop Viruses and Save Humanity Now. And it's a pleasure to be talking with you. Before I talk about the state of the current pandemic and what we might do about it, I just want to acknowledge that this pandemic is personal to each of us. There is nothing that's happened in living memory that has affected virtually everyone on the planet. India particularly went through a devastating and horrific experience earlier this year with COVID, and images were seen and experienced in India and around the world. So we've each been touched. We've lost family members, we've lost jobs, we've lost education, we've been disrupted in so many ways. So what I'd like to talk about now is where we are with the pandemic, and what we can do to bring this pandemic to an end. I mean, globally, we've lost over 4 million people, and we have tens of millions, if not hundreds of millions, who are going to have prolonged, maybe lifelong effects from the pandemic. Certainly, there will be effects on opportunity, education, employment, but also physical effects, and particularly respiratory effects, but energy and other things. So globally, we've gone through three major waves, at least. Individual countries have gone through 3 or 4 waves. We've seen dramatic differences among neighboring countries, with countries like the US having 3 times the rate as Canada. We've seen huge differences between parts of Asia, Japan, Korea, Singapore, that have managed pretty well, and other countries that haven't. We've also seen that no continent is safe. We had a point in July and August where if you looked at the 12 highest prevalence countries with the highest spread of the disease, there were 2 or 3 in Latin America, in Africa, in Asia, in Europe, in North America at any one time. So we know that no country is saved. And we now know that this is not a seasonal virus. We can't hope that winter will take it away. Human behavior is seasonal, so when we go inside for the winter, we're a lot more, or for the cold time, we're more likely to get it. But it's also been unpredictable in a variety of ways. The good news is that we have tools to prevent the spread. Highly effective vaccines. Some of the best have been manufactured from the beginning in India, and those vaccines have proven to be very safe and much more effective than anyone had imagined at the outset. We know that masking, good masks, well worn, reduce spread. We know that good ventilation and just distancing, all those make a difference. We have more and more effective treatments and more in the pipeline. And we have low-cost, convenient COVID tests. So we have tools in our armamentarium that we didn't even a few months ago. Some of them. So, what must we do to end this pandemic? It's going to take the biggest collaborative effort in human history in order to really stop this pandemic and get us back to what will probably be a new normal. COVID-19 is probably now here to stay, but we can end COVID-19 as a global pandemic. We can end the disruption that's causing in our lives, in our economies, in our opportunity for future for ourselves and our children and our families. So the three biggest priorities are global vaccination equity with over 70% coverage on every continent. It is just, it's not only immoral, but it's inexcusable that we're not moving quicker on making sure we have vaccination everywhere. It's affordable, it's achievable, and it's essential to everyone's recovery. As long as we have major populations around the world that aren't protected, we're at risk of getting more variants like the Delta that came out of India initially, or the Beta that came out of UK. That's going to prolong this. If we have a prolonged pandemic, it will undermine literally trillions of dollars of recovery, of economic recovery, and that is recovery of livelihoods, of opportunity, of trade, of commerce, of ability to travel, and both for recreation and for business. So global vaccination equity is absolutely vital, and it is affordable, it's achievable, and it is essential. The second thing is we need to keep going on improving our data and our science. The truth be told, the world was blindsided in January of this year, in the beginning of this year, when we realized the variants that were beginning to come, these mutations that make the virus either more contagious, more deadly, or immune to the resistant to the vaccines. So we really need to improve our data, our tracking, and also on the science side, continue the research on vaccines and on therapeutics. And by the way, part of the vaccine expansion needs to be supporting the global South, which already produces every year the majority of the world's vaccines, to have the capability to also develop new vaccines for pathogens, new pandemics that may be down the line. So the third thing is widespread adherence to personal protective practices. We can't, even when we're vaccinated, we know now that if the virus is exploding in a community and is taken off, we need to make our own risk assessment, and if there is spread, to the extent that we can, we need to mask. We need to be thoughtful where we can make a decision about participating in large events. We need to be thoughtful about that. And we need to also be thoughtful about ventilation, open windows. That keeps the virus moving and dilutes it. The virus, the Delta virus that was so contagious, that people with that virus, with that variant, they spread as many as 1,000 times the viral dose. There's a certain infectious dose and the amount of virus that'll give you the disease. If we have other variants like that, we need to be careful. So we need to really be aware of our own personal protective practices and make a risk assessment. You know, you do that when you decide how fast to drive on a road or other sorts of things that have some risk. In order to achieve global vaccination equity, to get the data and science that we need and to ensure widespread personal protective practices, we need leadership at all levels. We need it at the local level, the national level, and the global level. And we have some good leaders at all levels, but they really need to be held accountable by an engaged public, because our lives will not get back to normal unless our leaders are taking the actions that we know are needed and that are doable. Earlier this year, I did recorded a video, did an interview with Rima Nagaranjan from Times of India. And if you want to learn more about how we can both end COVID-19 and also prevent future pandemics from engulfing us, I would encourage you to listen to the accompanying video. In it, I talk about my 2020 South Asian edition of the book, The End of Epidemics, How to Stop Viruses and Save Humanity Now. And that's published by Amaryllis, which is an imprint of the Manjoo Publishing House, which you all know. So I think the Times of India will be having the video. You can get the book through Amazon India or other booksellers. We've experienced a lot over the last year since I did that interview, but the lessons and messages are the same. And if I could leave one parting thought, remember this moment. Remember what's happened to you and your families, your loved ones, your workmates, your people in your community over the last year and a half, almost 2 years. And remember that it didn't need to be this way. We have the tools in order to make the world safer. There are going to be outbreaks. There are going to be more COVIDs, unfortunately, but we can catch them sooner and we can win against them quicker if we are prepared and if we are doing the things that need to be done. And the technologies that exist, the capacity that exists around the world, in India, in South Asia, on every continent, that capacity needs to be utilized to prepare and then rapidly respond. Thank you for listening, and prayers for anyone in your circle, in your family, in your community, your workmates who are suffering now from COVID-19. We can work together to end it. Thank you for listening.
Good morning, Dr. Quick. Let me first introduce our guest, Dr. Jonathan Quick. He's family physician and health management specialist, who's currently the managing director for pandemics at the Rockefeller Foundation, which has an important presence in India, where they work with many states and also with the national government. He's also an adjunct professor at the Duke Global Health Institute. But the reason why he's our guest today is for his book, The End of Epidemics, The Looming Threat to Humanity and How to Stop It. And if you thought just about everybody is writing a book on pandemics in the season of COVID, then you have the interesting and fascinating bit is that Dr. Quick wrote this book in 2018, 2 years before the pandemic actually struck. Or in other words, he warned the world of this pandemic over 2 years back. Unfortunately, a lot of his warning and his advice on how to mitigate the effects of pandemic were ignored. So what we are going to do is quickly move to the questions where we can talk to Dr. Quick about what exactly he had warned the world about and how has the world fared in this particular pandemic. Dr. Quick, shall I start with the questions?
Yes, Rama, good to be with you, and let's move ahead.
Yeah. In light of the 7 steps you have recommended in your book for ending pandemics, how well do you think the world in general and India in particular fared in tackling this pandemic?
Well, let me start by reinforcing and resonating on your opening comment that this wasn't a surprise. It wasn't unexpected. And overall, collectively, the world was nowhere near as prepared as it could have been and should have been. And I think when we look around, we're going to talk some numbers today and all, but in human terms, this has affected virtually every family, every community on the planet, directly or indirectly. And if there's one message that I hope listeners take away is that this didn't happen. It didn't have to be this way. And we have created for ourselves a world that has many more opportunities, many benefits, technologies, and all, but also a world that in which there's far more risk due to travel or population, conflict, a variety of things. And we need to take seriously the need to really manage those risks.
And how do you think we managed this time?
Well, this
where
time,
did we?
Okay. Overall, let me tell you what's worked this time. I do think that the World Health Organization has, to a very large extent, done a superb job given the roles and responsibilities they have. Not perfect, and I'll say something about that. But the key thing is that within days of this being identified, this virus, the word went out. They have provided leadership in terms of regular daily briefings and messaging about what were the most important things at any one point in time in terms of responding to the epidemic. They've provided both stark assessments and reassurance, helped to catalyze innovation in terms of vaccine trials and other areas. At the same time, there are a couple of key things that they didn't move quickly on. The initial assessment in China was not as rigorous as it might have been. The second thing is that in a couple of areas, such as the airborne transmission, they were really slow to get the message out. But what was really missing in the context of a pandemic, it's not just the health team. Whether it's a company, whether it's a state, whether it's a country, you have to have a whole of society response, and you have to have all the different segments involved. So what
and
was
we did see different countries handling it differently, though the message that went out from WHO might have been the same. Every
Right.
country has dealt with it differently, and we have seen vast differences in how the pandemic has affected countries.
Yes, and so one of the key things that was missing is at the political level with the UN, G20, the G7. They should have been meeting. They should have been in touch. There should have been a unified plan. So that's what was missing. That said, indeed, there have been successes. In India's case, you really have bent the curve. I mean, it was a really rough 10 months or so into September, but overall, you brought the pandemic down, and that's been a really good effort. And the comparative death rates, average 100 deaths per million, are quite reasonable given India. But there's huge state-to-state variation. So Delhi, 650 deaths per million, compared to Maharashtra, 450, Punjab, 200, Gujarat, 70 deaths. So there's huge variations. And those inequities across the country are something that really need to be looked at. So
and you have warned us that this is not the last one, that this is not the last pandemic that the world will be seeing, or even India will be seeing. And in light of that, what do you think should be the way healthcare systems should be organized? Because if we are talking about equity, like you said, there's a question of equity. I mean, the way different states handled it differently. And if, we are talking about health system strengthening, what kind of a health system do you think we need to deal with the pandemic?
Well, the foundation for any health response and for improving health is a universal health vision and universal health program. The reality that everyone should have access to essential health services. as a human right. I mean, it's just part of living in a 21st century society, like free speech and safe roads. And that there are 50 countries that are there or on the way. So we know it's possible. Achieving that takes two things, basically. It requires financing and it requires a delivery system. Countries have achieved it in different ways with different combinations. And the financing mix may vary. Um, in Thailand, it's not all the national, it's not all the national government. They've built universal health coverage with a mix of employers and other sorts of insurances. The key thing is that you have got to be sure that everybody is included. What doesn't work and is deadly is when you leave it to individuals, poor communities, and individuals to pay the whole cost out of pocket, out of their own pockets. That doesn't work. So basically, you've got to have financing, which can be a mix of taxes and employers, and you've got to have delivery, which varies also in
So
the
you're
method.
basically saying
delivery
it can't be an
organization.
individual, you cannot have a system where individuals are left to pay for healthcare, depending on everybody's capacities, uh, especially in a country like India, for example, or for that matter, like you said, that you have definitely said that world needs to increase health spending. But we also saw the country with the largest health spending in the world, which is US, doing so badly in the pandemic, which goes to show that money alone will not solve the problem. So, I mean, there's also a question of, I guess, how you spend the money and where you spend it.
Exactly, exactly. Well, one of India's greatest public health visionaries, Ramalinga Swamy, famously said, more money for health, more health for the money. And so that's the critical thing. And we really need to invest in three things. We need to invest in a universal health coverage program that takes care of individual prevention, care, treatment. We've got to invest in public health services like water and pandemic preparedness. And we've got to invest in regulatory functions like safe food and medicine. And the reality is that in many countries, including in the US, we spent too much on the curative part, and we have been underfunding prevention for years. The problem that in the failure in the U.S. It didn't start 6 months ago. It's been going on 20 years. So the point is, you've got to be able, you've got to allocate enough money, but then invest in prevention. And it's not that expensive, and it is a whole lot cheaper than the cost of a pandemic. A whole lot cheaper.
And during pandemic control, that during the entire 10 months of the pandemic, we saw a lot of measures being put in place to stop the spread of the pandemic. And some of those measures are the ones that you had actually recommended in your book. But many of them were also, the pandemic control measures became more of law enforcement than public health. And how does that pan out on the ground when you treat a public health problem as a law enforcement problem and think of controlling the spread through the police force and use of law enforcers rather than community health workers or public health professionals?
Yeah, I mean, a force really should be a last resort. I mean, most people, when provided with the information by people they trust, and it's not necessarily the government, it's not necessarily the leader. Most people, when they understand and they get it from somebody they trust, they will follow the guidance. And we had there was lots of global attention in 2014 to the Ebola outbreak in West Africa, which was a disaster for the first many months. But once within the country, they got together with the religious leaders, in Sierra Leone, the 4,000 market women, with the traditional healers, with everybody. Once they engaged trusted local leaders, They got the message out, and the epidemic there went down quickly, literally within weeks. So the critical thing is to engage the trusted leaders, have a plan, and get the communities to see where the health of themselves and their family and their futures really relies on some pretty simple common sense behavior changes. Masking, distance, good ventilation, washing hands. It's not complicated.
But having said that, we also saw a lot of people who did not listen to some of these very simple measures. And one way of making them take these steps or measures or stick to them was the government, many governments launching, I think most governments actually launching apps which you could download on your phone, through which the government could trace whether you're leaving your home, if you're supposed to be under quarantine. In a sense, it was surveillance of a kind, but it was supposed to be something that was for the common good. It's necessary. Should people be expected to sacrifice privacy and individual rights for the sake of public health, or is there a balance? And if there is, what would be the balance?
Well, I think one of there are rights for and there are rights from. I have the right for freedom to speak and all, but I also have the right to be free from my neighbor killing me with their breath. And so I think we've confused the discussion by saying it's a one-sided discussion of rights. And so I think that in our Declaration of Independence, we say life, liberty, and the pursuit of happiness. We don't say pursuit of happiness above life and liberty. So I do think that there is a point at which the collective long-term welfare does come ahead of individual short-term, pleasure and freedom not to wear a mask. I think countries with the apps, the country with one of the lowest death rates, even though they were in the crossroads, is Singapore. They were very effective at that. And they did it in a way, there are apps which will really minimize risk to privacy. I think we need to push much harder on the technology, on the ability of technology to really protect your privacy. So yeah, I do think that there are times when those sorts of technologies work, but with really, really vigilant privacy protections.
You have also talked about citizen activism. What exactly do you mean as one of the steps to tackle the pandemic? What exactly did you mean when you said citizen activism?
Well, I think becoming informed, excuse me, about the risks that the world faces, which we need to take action on, whether it's the risk of pandemics or global warming or other local sorts of risks, being informed and then coming together to basically have a clear statement about what's needed and take it to the leadership. There's a wonderful group called Global Citizen, which is millions of largely younger people, but who around the world who are committing themselves to work in their own communities, their own states, their own countries, for a safer, healthier country and world that really supports human thriving and well-being. And the problem with leaders, whether they're political leaders or business leaders, is the politics and economics of now. They're faced with the current issues and they respond to those. And overall, voters don't reward leaders for preventing something, but they hammer them if for what they see was a disaster that could have been prevented. So we really need to come together because their attention is going to be bounced different ways.
Yes, I mean, when we are talking about prevention, I'm fascinated by, I'm going to read out from the introduction to one of your chapters in which you say, the chapter is called The Cost of Complacency. And you introduced that by saying, in addition to millions of deaths worldwide, we could face global recession and massive social upheaval. And that actually is exactly what happened. And you said this 2 years back. Uh, so, as you watched the pandemic unfold, uh, was it frustration? I mean, was it frustrating? Did you feel disappointed? What was it like watching, the way COVID was unfolding?
Well,
Considering that you saw all this coming and you had.
Yeah, at first it was surrealistic. I mean, I just couldn't believe it was happening, and I mean, it was just really, it was just hard to believe. And then it was just, I mean, I think the biggest feeling is just sadness, because seeing so many families hurt, so many people hurt, and also to see that this hit so disproportionately the disadvantaged. I mean, in this country, um, uh, uh, Black people, Latinos, they get COVID at multiple times the rates, and it's the same around the world. That it's the those who are most disadvantaged in society, and it's been that way on pandemics forever. Is that way in 1918? That it's the poor and vulnerable and historically disadvantaged who get hit the hardest, and that really reflects, in part, they're left out of the health system, they're on their own and all. And I think that the sadness that we've allowed those inequities to develop in the world, and now those inequities are fatal. They're not just uncomfortable and frustrating; they are fatal to a degree that is stunning.
And there's also the systemic failure that you talked about, that that we don't have, trace, detect the basics of public health, where which you have said, the three line of defense against diseases is prevention, detection, and response.
Yeah.
And obviously, I mean, we saw that failing at several, or at probably at all three levels in different countries. And why do you think that happened? And what do you think we need to do in the future to prevent this from a repeat of what we saw this time?
Well, so one of the things that we're involved in is the Rockefeller Foundation is a pandemic response platform that actually focuses on those first 100 days, which is really critical, even the first 2 or 3 days, to ask the question, what is the data that is needed to identify and validate that we have a new outbreak, and then what are the actions, and how do we prepare people to take those actions? So there, it is well known. The World Health Organization and has made it very clear the kind of preparations that are needed, and it really is, first of all, building the basic, to do those steps, the mechanisms for detection, rapid response, prevention before that, but also to rehearse those things. So have drills at least once a year. Each city, state should have its own outbreak response plan, and they need to rehearse them. They need to update them. They need to say, okay, and the hospitals need to do that. So when you get a hospital that doesn't know how to respond to an outbreak, it turns into a transmission center. It spreads the disease. So there are a number of basic steps that can be invested in, training that can and should be provided, and then regular, at least once a year, rehearsing those. Same thing with businesses. The private sector can play a really important role in providing a steady response in these outbreaks.
And and you also talked about in your book, about hospital beds falling short, people being hooked up to ventilators. Now that might not be something that would be surprising in a place like India, because we already function in a health system where there is a bed shortage. when you have the bed to population ratio is pretty poor. But it does come as a shock when you have it happening in places like the US or even Germany struggling to provide enough beds to people. So is there any point where you can say this is enough infrastructure for a pandemic?
Well,
Or
I think we need to be clear that the reason why we're struggling is because with hospitalization is because we haven't managed the outbreak to the extent that we could have and should have. So it's the failure of getting people to practice those basic, effective, safe living measures. That so I don't want to I there were shortages for sure for any reasonable outbreak, and so yes, we need to do planning for ventilators, for personal protective equipment, and have adequate quantities of that. But at the same time, one lesson we need to take from this is that we need to take these viruses much more seriously and really get them early on. And the difference, I mean, at 100 days with a pandemic, you may be at 1 million cases, and at 200 days at 30 million cases. It's that exponential growth that gives the surge. So it's really practicing the basic rapid detection, quick response, and have pandemic literacy. In other words, even starting in school and up from there, have people understand. When I was a kid, the big threat was nuclear stuff. I'd never seen a nuclear bomb, but I can tell you, kindergarten, we were outside, we rehearsed, and it was there. It was in our minds. We have to do that for pandemics and other global threats, so that people from the early ages start understanding that this is part of living in the world. It's just like what you do. I mean, it used to be that we had awful with all the traffic when cars were new, pedestrians getting killed all the time. I mean, so that's part of basic education, is look left or right, depending on what country you're in. That's what we need to do for pandemics.
It's one thing to talk about people being prepared to do it, but like you said, probably even businesses need to be organized a little differently, because as you have pointed out in the book, 3/4 of the major epidemic outbreaks that we have seen are zoonotic diseases, or diseases which have come from animals.
Yeah.
It's either come from the wild or from farms, where you have large scale industrial farming of dairy, or whether it's pig keeping. And so probably then business practices need to change too, don't you think so? And that we might need to have a more comprehensive look at health in terms of also animal health, as so closely connected to human health, what they call the One Health approach.
Yeah, yeah. And so part of that is in the surveillance, active surveillance. So we know, I mean, the people that have been studying coronavirus, I mean, that was on our, that was in the top 2 of the deadly threats. So we need to be really vigilant about that. The other thing is that not for coronavirus, but for influenza, which is actually also a threat. We still could have a repeat of 2018, or repeat of this pandemic in a different way with influenza. And that's where the whole chicken and poultry factory farming is part of the process. And so it's really important that those sources of food and all really are to the best standard. And there are standards within how you manage a chicken growing operation, chicken farming, and how you manage poultry farming to reduce the chance of being an incubator for the next pathogen. That's the risk. Those are part of a whole transmission cycle of, in essence, kind of incubating potentially.
Because they're also sites of antimicrobial resistance, which is another big threat that the world faces.
Yes, indeed. Yes.
So maybe is it time for nations to worry about health security much more than talking about guns and missiles as security, and investing more in that sort of defense rather than in health defense in a sense?
Yes, I mean, absolutely. If you look at just the body count, this is a much greater threat because of what we've seen. It can spread everywhere. This is the only threat that can travel to every country and every community. And there's almost nobody on the planet that's less than 24 to 36 hours from a major city by canoe, bus, plane. I mean, these pathogens can travel. And so wars are local, even when they're or regional, but this can go global. And is what we've seen. Our only defense up until now has been our own behavior, whether voluntary or obligatory because of laws and all. And so we really do need to take this threat seriously. And like I say, it's stopping pandemics isn't complicated, but it's difficult, and it means really mobilizing, being prepared, and then mobilizing the resources and public understanding and adherence to safe living practices.
The last one, because you have so much experience working in low resource settings, what do you think low resource countries, or what we call LMICs, the lower middle income countries, can do with little resources, but the reality of these pandemics in the future?
Well, I think a couple things. I mean, I'm always struck by the fact that wherever you are living in the world, people want to have a food on the table, a future for their kids, and a safe place to live. And when you provide a modest amount of support for education and training, so much of good health happens through good health practices and all, and common diseases can be pretty readily identified. So I think it's focusing on the main killers and what are the practical things we can do in terms of localized nutrition, economical medicines, and good public education and understanding of how we can protect ourselves. What are the measures? I also think that making sure that you don't have the small, rich population that exists in any country absorbing all the health resources and thinking they'll be well off when it's just not a healthy environment for the whole country. So that sense of equity and a commitment to basic health for all, that should drive public policy and resource decisions.
Right, Dr. Quick, thank you so much for talking to us. It was really fascinating. I really enjoyed reading your book.
Well, thank you, Rama, and it was really good talking with you. And I hope people will take a sense of what I would call concerned optimism. So we will get through this, but we need to learn.
Yes, thank you. Thank you so much.
Good day. Yep, take care.
Thank you for watching today's sessions. Please join us this coming Saturday between 5 to 7 p.m. to watch our upcoming sessions. We will kickstart the session with Ma Anand Sheila, who will discuss her new book, By My Own Rules, My Story in My Own Words. Next, we'll have Vaibhav Purandare in conversation with Kishwar Desai, discussing his latest publication, Hitler and India, the untold story of his hatred for the country and its people. Also, do not forget to talk about us on our social media handles and do use the hashtag TimesLitFest.